Good morning, class. My name is Jean Fonke. This is my presentation on the leadership action plan for the course NSG 7525. Patient fall continue to pose a critical challenge in the acute care setting, contributing to adverse patient outcome, extended hospitalization, and increased healthcare expenditure. As a metric of care quality and safety, fall prevention remain a core focus of institutional performance initiative. This leadership action plan introduces an integrated evidence-based solution that leverage predictive analytics and smart bed technology to proactively reduce fall incident. The proposed intervention align with institutional goal for patient safety and regulatory compliance, while also addressing the root cause of fall through real-time risk identification and targeted preventive strategies. It proposed a structure change, implementation, and strategy stakeholder engagement to transform the standard of inpatient care delivery. Patient fall continue to be a critical safety issue in acute care setting, with over 700,000 incidents reported annually in U.S. hospital and approximately 30% resulting in serious injury. The fall jeopardize patient safety and lead to extended hospital stay, increased healthcare costs, and potential legal consequences for institution. It emerged that traditional fall prevention strategies such as bed alarm or rounding schedules tend to be reactive and often fail to prevent incidents before they occur. But besides, there is limited integration of real-time fall risk data into a clinical workflow, which reduces the effectiveness of existing intervention. This challenge underscores the pressing need for innovative, predictive, and technology-driven solutions that proactively address patient fall risk. The purpose of this leadership action plan is to implement a proactive strategy that utilizes predictive analytics and smart bed technology to reduce patient fall in acute care setting. Arguably, by analyzing patient data such as age, mobility, status, medication use, and a history of fall, it's feasible to identify individuals at high risk of falling before incident occur. Besides, smart bed system will complement this by providing real-time monitoring and alert based on patient movement and behavior pattern. The ultimate goal is to significantly lower the incidence of fall and associated injuries, thereby improving patient safety and overall care quality. Additionally, this initiative aims to support nurses and clinicians with timely, data-driven insights that enhance decision making and promote a safer, more efficient care environment. Patient fall in acute care are a major safety concern, with between 700,000 and 1 million falls occurring annually in the U.S. Hospital and up to 30% causing serious injuries such as fracture and or head trauma, leading to a longer hospital stay, and higher healthcare costs. Besides, fall also damage patient trust and healthcare organization reputation, since fall-related injuries are considered never event. Medicare and other insurers do not reimburse the associated costs, creating a strong financial and critical incentive to prevent them. Also, current prevention methods like routine round and bed alarm are often reactive and suffer from issues like alert fatigue, reducing their effectiveness. This underscores the need for more accurate, timely and individualized fall prevention strategy to improve patient outcome and reduce avoidable harm. The proposed solution integrates predictive analytics with a smart bed technology to create a proactive and dynamic fall prevention system. Predictive analysis uses real-time patient data such as age, medication, cognitive status, and mobility to continuously assess and update each patient fall risk, enabling targeted and timely intervention. Smart bed equipped with sensors monitoring patient movement, detect unsafe exit attempts, and immediately alert nursing staff, allowing for rapid response before a fall can occur. This combination of data-driven risk assessment and advanced monitoring technology offers an individualized and precise approach to fall prevention. CHO 2020 demonstrated that analytic tools using predictive model can effectively identify inpatients at a high risk of falling and improve fall prevention outcome. According to a CHOI 2025, nurses expressed positive perspective to adopting smart technology such as smart beds, recognizing their potential to enhance patient monitoring and safety. Additional, DICS 2023 also conducted a cost-benefit analysis confirming that implementing evidence-based fall prevention program lead to both fewer inpatient fall and reducing healthcare costs. Also, Ledios Martin 2022 found that machine learning model improve the predictive validity of inpatient fall risk assessment beyond traditional method. Finally, WEN 2024 reported that the integrated LOT patient care system, including smart bed, contribute significantly to preventing patient fall through real-time monitoring and alert. Smart bed technology offers significant benefit in acute care setting by continuously monitoring patient movement and promptly alerting nursing staff when fall risk increase, which reduce patient movement-related incidents. Additionally, this bed help alleviate nurse workload and reduce alarm fatigue by using intelligent alert systems that limit unnecessary alarm, improving nurse response efficiently. Evidence from WEN 2024 indicate that hospitals implementing integrated LOT smart bed system experience significant reduction in fall rate and enhancement in overall patient safety. The integration of predictive analytics and smart bed technology significantly improves safe quality care by preventing patient harm through early identification and mitigation of fall risk as demonstrated by CHO 2020. Real-time monitoring capabilities enable healthcare providers to respond swiftly to incident, reducing delay in care. Moreover, this technology enhances patient-centered care by promoting comfort, safety, and autonomy, with aligned with a nursing perspective on smart technology. Patient fall remain a leading cause of injury in acute care setting, such as highlight the urgency of implementing more effective prevention strategy. Notably, traditional methods often fail to predict or prevent fall in real time and leave patients vulnerable. This project addresses the gap by integrating smart bed technology and predictive analytics to enable early intervention and rapid response. The immediate goal is to reduce inpatient fall and improve safety outcomes. The long-term aim of the initiative is to embed a culture of proactive safety management, supported by continuous learning and data-driven decision-making, ensuring sustainable improvement in care quality. Other 8-step change model was selected to guide this project due to its culture and practical approach to managing organizational change, especially in complex healthcare environment. The model begins with creating a sense of agency. We help engage stakeholders early and emphasize building guiding coalition to champion the adoption of predictive analytics and smart bed technology. A stepwise process support phase implementation, allowing for gradual integration, feedback, and adjustment. Moreover, the model focuses on empowering staff and embedding new practice into the organizational culture, ensuring sustainability of change. Is proven success in healthcare change initiative make it a suitable framework to navigate the challenge of adopting innovative fall prevention technology. Creating a sense of agency is critical to motivate the organization to act swiftly on reducing inpatient fall. Besides, the current data reveal a rising trend in fall incidents that lead to a serious injury and increased healthcare costs, will directly impact patient safety and hospital resources. Therefore, emphasizing the data will help highlight the immediate risk and the necessity to promote intervention. Building a guiding coalition will involve assembling a strong multidisciplinary team to lead the change effort. This team includes nursing leaders who will champion the workflow adjustment, physicians who provide clinical oversight, and IT specialists responsible for deploying and maintaining the smart bed technology. Besides quality improvement, personnel will play a key role in tracking progress and evaluating outcome, while patient safety officers ensure that intervention comply with a healthcare standard. The vision for this project is to significantly improve patient safety by integrating predictive analytics with smart bed technology, fostering a culture to proactive fall prevention and continuous improvement. We will use multiple channels such as staff meeting, targeted email, poster in key area, and dedicated training section to communicate the vision to all the staff. Arguably, a clear and consistent messaging will highlight the goal and benefit of the proposed intervention. Activity to empower staff and generate a short-term win will include comprehensive education and hands-on training. The approach will ensure all personnel are confident in fall prevention strategy and the use of smart bed technology. Arguably, empowering staff to proactively identify risks and use the new equipment effectively is critical for success. Early milestone and pilot success will be celebrated publicly to boost morale and sustain momentum, while sharing the positive outcome will motivate outgoing engagement and commitment to the project goal. To sustain and anchor change, it will be essential to embed fall prevention practice and smart bed technology use into everyday routine, policy, and the organizational culture. SUH will foster a strong safety mindset. Besides, Continue monitoring for fall rate and technology effectiveness will provide critical data to guide ongoing improvement. This data-driven approach will support regular staff training, update, and process refinement while recognizing and reinforcing positive behavior help maintain the momentum and ensure that the new practice become a permanent part of the patient care. Stakeholder engagement will be pivotal for the successful implementation of this project. Internally, senior executive leader will be instrumental in securing resources and align the project with the hospital strategic goal. Besides nurses, as a frontline user, we play a critical role in operationalizing the change and providing practical feedback. Also, the IT department will ensure seamless integration of smart bed system with electronic health records, while QI team will track performance and guide adjustment. Externally, vendor offer essential technology and training, and regulatory agency ensure the initiative meet required patient safety standard. By aligning interests and fostering collaboration across all stakeholders, we increase the likelihood of long-term success. Establishing strong alliance is essential for the success of this initiative. The IT department is a critical partner for ensuring that the smart bed technology integrates smoothly with a clinical system and receive ongoing technical support. The financial department plays a strategic role by evaluating the cost effectiveness and securing budgetary commitment. Equally important are vendor partnership with supply the smart bed, offer training, and ensure timely maintenance. Our engagement strategy includes cross-functional meetings that align goals across departments, while transparent communication and feedback loop ensure all voices are heard and drive collective ownership and initiative. To ensure smooth implementation and adoption, several strategy activities have been outlined. First, a comprehensive education plan will deliver role-specific training to staff, ensuring they understand and feel confident in using smart bed technology. Besides, infrastructure readiness is key. It will include preparing the physical and IT environment to support new devices. Integration into daily workflow will ensure that smart bed alerts and data contribute meaningfully to clinical decision. Ongoing staff feedback mechanism, including survey and forum, will capture frontline insight. Simulation section will offer hands-on experience to reinforce learning and support long-term engagement. Stakeholder engagement activity will begin with a structured kickoff meeting and listening section that encourage input from clinical, IT, and administrative leaders. Besides, stakeholders will help co-design implementation strategy to ensure alignment with a workflow and organizational goal. Also, regular communication will be maintained through newsletter, dashboard, and open forum that promote transparency. Additionally, interactive Q&A section and feedback round will foster responsiveness and improvement, while recognition event will celebrate participation and early win. Lastly, long-term engagement will be supported by integrating these efforts into a shared governance structure, and interdisciplinary committee. The plan begins with defining specific fraud prevention competencies that align with our predictive analytic and smart bed technology intervention. Educational material will be developed in multiple formats that include brief training video, visual poster, printable job aid, and interactive e-learning module. This approach will help accommodate diverse learning preferences and staff roles. The distribution will occur through established channels such as internal email, the hospital intranet, uni-level briefing, orientation program for new hire, and printed material in a high-traffic staff area. We will monitor staff engagement through attendance, feedback, and system analytics, and revise the material periodically to ensure they remain current, relevant, and impactful. The implementation will follow a structured timeline to ensure efficiency and quality outcome. In the first 2 months, we will focus on securing stakeholder buy-in, finalizing project approval, and resource allocation. Month 3 and 4 will involve infrastructure readiness and coordination with vendors to prepare for rollout. Training of clinical staff and a limited pilot implementation will occur in month 5 and 6. Based on evaluation of the pilot, we will refine the process and expand to a full rollout in month 7 through 12. Key performance indicator will be monitored continuously, and staff feedback will guide real-time improvement throughout the year. The project is expected to include both recurring and capital expenditure as highlighted in the above table. A few ethical and legal considerations will come into play during the implementation of the proposed initiative. For instance, compliance with HIPAA will be paramount, especially when handling patient data through the preventive analysis tool. The IT team will ensure that only authorized personnel access the patient risk score and further ensure that audit trails are maintained. Additionally, from the ethical perspective, fairness and equity will guide the implementation. The predictive model will be reinforced to ensure that they do not reinforce the existing bias or result in unintended discrimination. Besides, the staff will be trained to critically interpret the predictive alert and to integrate the insight into holistic patient-centered care. Overall, a consideration of the above approach will be incredible in the fostering ethical and legal compliance. Strategic leadership will play an incredible role in the implementation of the predictive analytics and the smart bed technology to reduce patient fall in the facility. Its core responsibility will include vision setting, stakeholder engagement, resource allocation, team coordination, evaluation of outcome, and ensuring compliance to the established legal, ethical, and accreditation standard. Overall, strategy leadership will be incredible in transforming fall prevention efforts to attain the desired outcome. Conclusively, reducing fall in acute care setting remains a pressing and persistent challenge that requires the adoption of innovative and data-driven solution. The leadership action plan proposed the integration of predictive analytics with smart bed technology to leverage on real-time data to proactively mitigate fall risk and enhance patient safety. The implementation of the proposed initiative will be guided by the 8-step change model to reduce resistance to change and manage potential barriers to its successful implementation. Also, strategy leadership will play a great role in the successful implementation of the initiative by providing direction, fostering collaboration, and ensuring accountability through the project life cycle. That's it for my presentation. Thank you.